You make my world a better place.
Yes!
Hey there, mate. He's walking with me.
I can depend on you.
The Bondi Clinic attracts its share of colourful characters, and today Mr Pettibone and his devoted owner Henry are on their way in to see Dr Chris. Henry and his West Highland White Terrier are inseparable. Henry on his Harley happy to play chauffeur, and Mr Pettibone riding pillion backpack style.
You right? Come on.
Dogs riding around on motorbikes isn't new. You look in the country and plenty of Kelpies do it. But in the city, as a West Highland White Terrier, facing backwards in a backpack, that's never been done before.
Neil, how are you?
Yeah, good, thank you. Nice to see you.
Good to see you again.
Yeah, where's Mr Pennybones?
He's here waiting for you.
Back sack.
Usual happy self.
Hello, little fella. So happy there. All right.
I need to see Chris.
All right, I'll let
that
him know
ear of
that
his
you're
is
here, if
back in trouble.
all right.
Great.
All right, just take a seat and I'll let him know that you're here.
Want him on the scales?
Yeah, we'll pop him on.
Great, thanks. I don't have a car, and I was shopping for some pet food for him when he was a puppy, and I saw the harness and I thought, I wonder if I could put him in that and get him on the bike. And I checked out the laws, and then the first ride out I had a friend with me who's a keen animal lover, and he rode behind, and I said, I want you to be dead honest about how he responds to it all. And he rode behind and he said, it looks like he just dug up a bone, and which made me really happy. Want to hop on the scales? Hop up, sit, sit. Good boy. Ooh, put a bit of weight on. 10-6, Neil.
Okay, thank you.
He appears a little bit nervous, which is funny because, you know, we come along here at a fair clip sometimes, and not within the speed limit, of course, but, you know, he gets around on the back of a large motorbike quite comfortably, but coming to the vet, he just is a little bit too, I don't know about this. BB, kiss. Give me a kiss. Mr Pettibone, give me a kiss. Oh, you're kidding. Wait.
Mr Pettibone suddenly isn't in the mood for kisses. He knows something is up.
How are you, Henry?
Chris.
Hey, good to see you.
Good to see you again.
That's the way.
Mr Pettibone's back to see you.
He's on 4 legs instead of 2 wheels.
He's left them out the front. You want to say hello to Chris?
Hello, mate.
Yes.
Hey, buddy. Come on through.
Come in with him. Come on. Good boy.
Excuse me. Come on. We can't offer you motorised transport now. You're going to have to do it all by yourself. Yeah.
Mr Pettibone.
You're going to have to come with us now.
Go on.
Even though this biker dog isn't wearing the leather jacket or the patches or doesn't have the tats, he's still showing every bit of attitude we'd expect. He does want to see the vet. Maybe one day we'll go riding together.
Come on.
It is a postie bike. Maybe that was the hesitation. Fair enough. Come on, let's go.
Good boy.
How's he been?
All right, apart from that ear.
Yeah.
I've just been on holidays, come back, and it was a problem again. So I thought I'd better bring him in and let you have a look at it.
Yeah, sure.
And there's also, just below your hand, is he seems to have developed a lump, which I'd like to know about.
Okay.
Just down there it is.
All right, let's look at this lump first.
I'm feeling worried sick to the stomach at this moment. I've lost a dog to cancer before, and frankly, having that dog put down was the worst thing I've ever had to do in my life. I'm terrified of what that lump could be.
Hello, my baby. Misty Blue. Hi, baby.
At the Bondi Referral Hospital SASH, Faith and little Hugo have brought in a tiny 5-week-old kitten.
She wasn't eating, so I've been syringe feeding her for about 2 weeks, but I've noticed her breathing has got really heavy. I don't know what's wrong with her. She might have pneumonia or something, but I do anything to save her.
Hello, I'm Lisa.
How are you?
Hi, how are you?
Good. I'm Faith. This is Hugo.
Hello, who's here? Misty?
Misty Blue.
Okay, bring her through.
Higgy. I don't know, there's just something special about her. And I just think she was brought to me for a reason. Also, I just hope nothing too bad is wrong.
So what happened?
Well, I got her from the pound 2 weeks ago. I saved her from death row, and her mum was put to sleep because she had the cat flu. So we had 2 really good days of her eating, but then I just noticed her breathing last night, and I thought, well, it's getting worse, and then I thought I'd bring her in because it was quite shallow.
Well, let's pop her up on the table. As soon as Faith takes Misty Blue out of the blanket and puts her on the table, I can tell straight away that her breathing is not normal. She's got so much abdominal effort, her chest is moving so much more than it should be, and this little kitten has got something seriously wrong. So she's obviously not been able to run around as much as some of the other kittens.
I've never seen her run. She'll play with a stick.
But she's pretty quiet.
Yeah, she's quiet.
Okay, well, I imagine she's not going to be able to do much with her breathing like that. I'm just going to take a listen.
It's all right, little girl.
Okay, there's definitely something sounding abnormal there.
Oh, baby.
Let's look at this lump first because they can come up, I guess, reasonably quickly, but they have this very distinctive feel to them.
Mr Pettibone is one of Chris's regular patients at the Bondi Clinic. Devoted owner Henry has just pointed out a newly formed lump on his little mate's chest.
How old is he now?
About 8.5.
Yeah.
I'm terrified that it could be something horrible. I've lost a dog to cancer before, so despite everything, I'm feeling very, very nervous today. It's okay. It's okay.
Owners are always incredibly concerned when they see a lump on their dog or cat, and with good reason. Sometimes lumps can mean really bad news. I'm pretty sure I know what that is. See, a lot of dogs, once they reach a certain age, they're quite prone to developing little lumps called lipomas, which are fatty lumps.
Right.
They're quite soft because essentially they're just filled with fat.
Big question is, are they dangerous?
They shouldn't be.
Good. I love that dog more than life itself, and my head just went to the worst scenario.
Let me get a little sample out of that.
Yep.
And we'll see what we find.
Okay.
You can feel a lump all you like, but the only way of knowing for sure is by sticking a needle into that lump and drawing some cells out.
It's okay. It's okay. Good boy. Good boy. Good little fella. Yeah, it's all right. Extra smoked salmon this afternoon for you. Good boy.
Did you say smoked salmon?
I did say smoked salmon.
It doesn't really go with the image, does it? Come on.
Don't tell anyone.
All right, so that's a pretty decent sample there. You can see it's quite clear.
Okay.
So also when I put it across the slide there, it streaks across and then it gathers into droplets.
Right.
Okay.
Oh, I see that now, yep.
Yeah. It's one of the simplest facts of science that oil and water don't mix. So if this is from a fatty lump and full of oil, then putting a few droplets of water on it and mixing them together should tell us if it is actually fat. See that?
Yep.
See we've got an oil slick on top of there?
I can see that very clearly.
So that's a pretty rough test, and I'll still look under the microscope to make sure, but the thing is that oil and water don't mix.
So it's a reassuring indicator for him?
Yeah.
Lucky fella.
That should be a fatty lump.
Right. When Chris took the sample out of the lump and explained to me it was a fatty lump, as he so technically called it, my heart returned to a normal rhythm. I was so glad because I was so nervous that it could have been something horrible, but at this stage I'm feeling a lot more relief that it's just something fairly innocuous.
But Mr Pettibone isn't out of the wars just yet.
Okay, so these ears.
Okay, his right ear has flared up again.
Yeah.
I was away for a bit and my daughter was looking after him.
Yeah.
And she did a fairly good job, but the infection seems to have gotten away a bit.
Yeah.
It doesn't look like she's had any trauma. It's not like she's being run over or anything.
At SASH, Lisa is trying to find out why Misty Blue's breathing is so laboured.
I'm sick from worry.
Owner Faith rescued the tiny 5-week-old from the pound, and she's desperately worried because the fragile kitten is struggling.
All right, so it's pretty obvious that she's not breathing normally. When I listen to her chest, I'm actually hearing gut sounds. So that concerns me a little bit because the gut sounds should be in the abdomen. So she might actually have like a hole in her diaphragm and her organs have come out of her abdomen into her chest.
So how would that have happened to her this young?
At this young, it may have been something that she has had from birth.
It's all right, darling.
From my examination, a diaphragmatic hernia would be at the top of the list, but other possibilities would include fluid in her chest, some sort of a mass, an infection. Without taking some x-rays, I'm not going to be able to tell.
Is there a chance she can be saved?
Look, if it's a diaphragmatic hernia, or if she's got some sort of hernia into her chest space, the only way that we can really fix it is to do surgery.
But she's so little.
She's tiny.
The infection seems to have gotten away a bit.
Yeah. Okay, so he's finding that to be quite sore, and is he rubbing at it?
Scratching at it.
Yeah.
Shaking his head.
Yeah.
Recurringly.
Yeah. Okay.
At the Bondi Clinic, Chris is investigating Mr Pettibone's persistent ear infection.
What I find interesting about this is that it's flared up when you've been away.
Right.
Now, obviously you have been around to look after him, but the one thing that helps ears out, the one thing that prevents infection in ears is ventilation, is airflow.
Right.
When you're away, what doesn't he have? Doesn't have the rides on your bike.
Doesn't have the bike.
What you probably find is that when he's on the back of that bike, it's the best natural ear cleaner and ear dryer you can possibly hope for. Because that wind rushes through his hair and dries out any moisture sitting in those ears. When you're away and it doesn't happen, this happens. The fact that Mr Pettibone's ear on this side hangs a little bit lower, I'm sure is actually playing a part, because what it's doing is reducing how much ventilation, how much airflow this ear gets.
Maybe that's the whole thing. It's not the image, it's the ear.
It's his best medicine.
Look at that. Self-healing mutt. Who would have thought?
So we'll just put some drops in there now.
This is the part he doesn't like.
Along with the drops, Chris is also cleaning out the Westie's ear.
Just give that a little bit of a... I think that face says it all, doesn't it? These drops will work incredibly well to take out some of the inflammation, but also treat the infection. Okay, so that's looking a lot better there now.
That's looking great, very clean. Yeah. And all that, what's that scientific word he used, gunk?
I think it was gunk, yeah.
Yeah, all the gunk seems to have gone.
You can look it up if you like, it's in all the major vet textbooks.
Oh, fantastic.
Mr Pettibone was apprehensive about coming in here in the first place, but he shouldn't have worried. What I've done is actually hook him up with more bike time. That's got to be good news.
You ready to roll?
It's time for him to hit the road. And he hits the road in style. See you later, Henry.
Oh, wow. That is not good.
At SASH, Lisa has just x-rayed tiny rescue kitten Misty Blue to find out why she is struggling to breathe.
She's got a massive hernia. So she's just got all these abdominal contents in her chest with this tiny little bit of lung, and no wonder why she can't breathe normally. That is shocking.
That's really bad.
We're gonna have to tell your mum. It doesn't look very good, sweetness. No. The only treatment for Misty Blue's condition is surgery, and it's pretty risky for such a tiny little kitten. I'm gonna go tell Faith the news, and I hope that she's ready for the commitment.
Hey, baby.
Okay. So we managed to take the x-rays. She was a very good little girl for them. And they do confirm that she's got a diaphragmatic hernia. Now what that basically is that there is a hole in her diaphragm and her abdominal organs, so intestines and possibly even a bit of liver, have come through this hole from her abdomen and they're sitting in her chest.
Oh my God.
Okay, so that's why she's breathing so hard, because she's trying to use all her energy to make that tiny little bit of lung work, because there's just no space for the rest of the lungs. And you know, it's not something that she's going to get better with if we do nothing. And in fact, her breathing is just going to get worse and worse. And if more organs go from her abdomen into her chest and take up even more space, then the amount of lungs she's got to breathe with is going to be even less. And you know, she may not survive that.
Oh, she's so beautiful. She's come this far, you know, from the pound. I just wanted to have a chance.
Well, she's lucky to have you, and you brought her here, and this is her best shot.
And she's purring. She's got a big operation tomorrow.
We're going to look after her, I promise. Breaking this news to Faith is so difficult. She's so connected and attached to Misty Blue. She loves her with all her heart. And now she knows that without this risky surgery, Misty Blue probably won't survive. And there's a chance she won't survive the surgery either. What a huge step Faith has to take.
I love you, Misty.
Okay, let's tuck her into bed. We'll look after her, I promise. Okay, we're gonna look after your little one. Okay, we make a promise to your mum. We'll do our best to get you through this. Okay, lovely. You go in here.
Love you, Bubby.
Kind of feels like I'm clearing out the clinic.
Chris needs plenty of supplies because he's off to a remote location to visit one very special patient.
Hey Neil, you might want to order in a few more sedatives. We're now officially all out.
Well, only just order them a few days. There should be plenty here.
Yeah, well, I'm treating something big.
Big?
Big.
Right, okay.
And I don't think I'm around in the books for the next few days.
Where are you going?
South Africa.
What, now?
Yep.
Oh.
I'll see you later.
All right then, bye.
Thanks, mate. Every now and then you get a call to go and help an animal that you just can't refuse, and this is definitely one of those.
Chris has travelled to the vast Shamwari Game Reserve on the southern coast of South Africa. He's been invited to be part of an important elephant conservation program.
You would not believe it, but we're going to make an elephant asleep.
It's all happening now.
Chris is joining doctors Johan Hubert and John O'Brien, and the bull elephant they're searching for today is young, fertile and dangerous.
We need to dart him basically with a dart gun. So we anaesthetize the animal and then we need to do some contraceptive work in it.
So it's still up here?
Yeah, but it's out in the open. You see, when we dart, you know, what we really got to consider is it can take 10, 15 minutes for the animal to go down.
Sure.
They can also move a long way in that period of time. So we don't want to do it where it's right, even in the open, but with thicket all around, you know.
You can safely assume that this elephant isn't going to want to have its contraception or have a blood sample taken. And when you're talking about something that's the size of a small truck that can charge you, we have to be so careful here.
Is that him? Okay, this is in, Chris.
Wow.
Hi, beautiful. I know.
The team at SASH are about to start the urgent operation to repair tiny Misty Blue's massive hernia.
Good girl, Misty. Very brave. Hopefully we can fix you.
Specialist surgeon Dr. Steve Burnside will be carrying out the delicate procedure.
The reality is with this surgery that she could die at any time. Unfortunately, being so small, being compromised to start with, it really is touch and go. Here we go, girls.
Yep, holding.
Let's do it. The clock is ticking. Making an incision, girls. Alrighty. I don't think I've done an animal this small before.
She's just so tiny.
Here's the hole in her diaphragm here. It's massive. It goes directly through into her chest. This cat only weighs 300 or 400 grams, and yet she's got a hole the size of a 20-cent piece in her diaphragm, which is just quite amazing.
The hole in the diaphragm has resulted in Misty Blue's organs being in the wrong spot.
All right, trying to find her kidneys. Spleen, where's the spleen? Everything that should be in its abdomen is now in its chest. What do we got here going on? Yeah, this liver is not coming out how I want it to come out. It just keeps wanting to go back into the chest, which is a problem.
Suddenly, there is a problem.
What's that, mate?
We must have a leak somewhere. We can't ventilate unless we have a seal.
Come on, Misty Blue. Hold in there, tiger.
Is that him? Okay, this is in, Chris.
Wow.
At the Shamwari Game Reserve in South Africa, Chris and the team have spotted the young elephant.
This is the bull we're looking for. You'll see he's got a nice big tear in the top of the right ear.
This 20-year-old male has been singled out for contraception.
There's no doubt that the poaching and killing of elephants has been a huge problem throughout Africa. But in recent years, certain pockets have found their numbers have gone through the roof. Now they're left with two options. You either kill the elephants or use contraception, because if those numbers stay the same, it's just too damaging on the environment.
All right, now you see he's on the bank of the river,
Yep.
and he's going to follow a road that runs parallel to the river. My recommendation is we let him walk to get into the open area on the other side.
Sure.
And we dart him there.
Yeah. So the risk is that if we do it now, that river could be where he heads.
Absolutely. If he had to get drowsy and actually go down to the river and fall in, he'll drown.
It's crucial the team gets close enough to dart the elephant so the contraceptive can be administered. But they don't want to spook him.
As with anything, humans, animals, there's this comfort zone. If I had to go too close to him, he would feel that and he'd get grumpy. He'd either run off or he'll turn around and say to us, back off, you know?
All of a sudden, the elephant starts heading away from the river, and Chris now urgently needs to get ready to dart him.
Okay, Chris, would you like to pressurise and then load him?
Yeah. So the plan is just to wait here and see if he heads into an open space there?
Yes, and I think once we're pressurised, I'll go round so that I'm in the open area itself.
Yep. There are a couple of challenges here. I mean, first of all, elephants have incredibly tough skin, so you need to be able to penetrate that with a dart. But you don't want to use so much force that it actually causes injury to that leg.
This you can go the middle of his backside, eh?
Yeah. Okay. Is it a better position now?
Yeah, it's quite nice. It's in the open area.
Okay.
Hopefully it won't run too much once we dart it.
Right.
I'm going to go a bit forward just so that we can get a better shot of his shoulder because the wind moves the dart quite a lot.
Yeah. Okay. The fact is, I've got one shot at this. If something goes wrong, he could turn and charge, and from that distance, a dart ain't going to stop him.
That was a perfect placement.
Didn't like that at all. It looks like it has fired, do you agree?
Yeah, I think so. Johan's checking to see. Did it go in?
It's fine. The plunger is down, so it's fine.
Great.
He's not happy.
Chris is working alongside the reserve's vets, Dr. Johan Hubert and John O'Brien. Now the elephant has been darted, it's a waiting game for the tranquiliser to take effect.
He seems a little bit agitated too. You can see he's spinning around and shaking his head and flapping his ears. Even though it was only 2 mils of anaesthetic, you can see just how powerful it is. There he goes.
The bull is finally down, but has fallen awkwardly, and now he's in grave danger.
Because of the big stomach, you know, the pressure of the diaphragm, we need to get him sideways.
So essentially crushes his own lungs.
Yeah.
We've got a bit of a problem here. I mean, the way he's sitting like a dog, it's fine for so many other animals, but for an elephant, it means tons and tons of weight are pressing down on his lungs. The fact is we now need to roll him onto his side, otherwise we risk losing him.
It will be impossible for Chris and the other 2 vets to move the 4-ton elephant, so reinforcements are called to help.
Okay, we need you to come in as quick as you can, please.
Yeah, I am coming.
All right. I think we can get out now and check.
Yep.
The big bull is in trouble, and suddenly...
Chris? Sorry, there's elephants running up behind. Okay. Sorry guys, back on the vehicle, please.
So is the team.
Yeah, Anya, stay behind it. Let it go past us, please.
The problem we've got right now is that he's sitting in a dangerous position. We need to roll him onto his side. That's where these guys come in, but the problem is that this elephant over here that's circling and looking quite agitated too.
Alright guys, we've just had an issue.
What's that, mate?
So we must have a leak somewhere. Lara, can you come and seal this cuff and just make sure there's no leak?
At SASH, tiny patient Misty Blue is causing some anxious moments for the surgical team.
She's just tiny. It's like anaesthetising a little mouse, and our equipment's for, you know, bigger dogs and bigger cats, but we can't ventilate unless we have a seal. Okay, sorted.
Dr. Steve Fernside is halfway through the process of moving Misty Blue's organs out of her chest cavity.
I think we've got everything out. Now I've just got to be careful here to stitch everything up.
And back into the tiny kitten's abdomen.
The abdomen's never had all those organs in it before. Everything is just so small in here. Everything just doesn't fit. It's just so small.
I'm not trying to rush you guys, but she's not doing that well.
No, mate. I'm almost closed.
Yeah, we kind of need to be done right now.
Ooh, righty.
Let's get her out of there.
Oh. Okay. Things have gone pretty well. It's a bit dicey, but hopefully this has been enough to give her a successful future, because she certainly was going to be in trouble without it. Well done, team. So we're just waiting for her to recover now. It's gone smoothly and she's holding in, but it's pretty touch and go here, because she's been through a lot in the last half hour or so, and this is obviously when things can go pear-shaped as well.
We need to get to that one, but we can't because of that one.
At the Shamwari Game Reserve in South Africa, Chris and the team anxiously need to reach a tranquilised elephant.
The problem we've got right now is that he's sitting in a dangerous position. We need to roll him onto his side. That's where these guys come in, but the problem is that this elephant over here that's circling and looking quite agitated too. It's all happening, huh?
The intruder suddenly loses interest.
He is going to join up with the herd.
Yeah.
So he'll go into those bushes. I think we can actually drive a bit closer.
Yep.
Just so we've got the vehicles there for safety. All right, Bruce, we're going to start putting him over.
Finally, they can get to the tranquilised elephant.
Wow, it's incredible.
Time is critical. If the huge beast isn't moved quickly, its lungs will be crushed.
That's the dart there. You can see the plunger's right to the top, so he does actually have all of those drugs on board. So that's a comforting sign when you've got this many people around an elephant. It's time to get this elephant on his side, and that means all hands on deck.
but the massive beast won't budge.
There's only one other choice. Bring in the car. It's time to exchange manpower for horsepower.
Get a bit more, Bruce.
There are a few tense moments to be had yet, I think.
At SASH, the life-saving surgery to move Misty Blue's organs from her chest cavity back to her abdomen is over.
Just a case now of her waking up.
But Dr. Steve Fernside can't relax until he finds out if she's breathing properly.
That's her breathing?
Yeah.
Wow.
It's much slower and deeper. She's taking...
She's actually breathing properly.
Yeah,
First
really
time in
good
her
breaths.
life. This is remarkable. She's actually taken these breaths by herself and they're just slow and rhythmic. Whereas before it was... Now she's actually able to take a deep breath, you know. Must be a hell of a feeling. Well done, team. That's great.
Good job. Misty says, thanks, Steve.
Little Misty, she's a true champion. She's a real fighter because I have to say I had my reservations about whether she'd make it through this, but she's a tough little kitten. That's no doubt about that.
Hey. Hey, welcome back. I know.
Oh, it's nice to see you back, girls, isn't it?
I know. We need to give you some pain relief. Good girl, Misty. Are you alright? Hey? But you just stay with us and keep fighting. So be ashamed to get this far.
In South Africa, Chris and the team are urgently trying to roll the tranquilised elephant onto its side.
There's only one other choice. Bring in the car. It's time to exchange manpower for horsepower.
If they can't manoeuvre the elephant, it's at risk of crushing its lungs.
Get a bit more, Bruce. Hey, whoa. Nice and gentle.
Well done. It's amazing. He's fully out now. All right. Okay, so you can hear the air rushing out of this trunk here. This is how he's going to be breathing right now. So just so he can breathe and keep him stable, we just need to keep that nice and straight. All right, so blood samples first.
Yes, yeah, just flap it completely over. There we are.
Oh, it's a big hair.
So what we do is we close the eye, and you've got quite a nice vein to take blood from, eh?
With the elephant stable, it's time to perform some blood tests.
If I miss that, there are serious problems, aren't there? The whole point of this blood test is to measure his testosterone levels. That's the hormone we're trying to suppress, so we need to know its levels before he has the contraception.
So it's almost for two reasons why we're doing this. Is the one that we want to suppress testosterone for the behavior, and the other is almost like trials that we do to see if this is a way of contraception that we can use.
If trials are successful, more bull elephants will be given contraception. This will help control herd numbers in parts of South Africa where they simply can't sustain so many elephants.
He's a bad boy.
He's actually quite a bad boy, quite a naughty one, yeah. We were actually quite fortunate to get him in the open like this.
Yeah. This might just pull him back into line.
With the blood testosterone level determined, Chris can work out exactly how much contraceptive vaccine to give this young bull.
Right, so in the elephant world, it's the male that goes in the pill. So he's just going to get 5 mils of this drug here. The whole point of this injection is to essentially stop any of that alpha male aggressive or dominant behaviour, but also importantly, it's going to stop him from breeding. Okay. Now that all our work here is done, it's time to wake him up with a reversal agent. Now, I've been caught out in Africa before with animals waking up just a little bit quicker than I thought, so we're not going to take any chances here.
Okay, thank you.
Let's go.
She's a little fighter, a real little fighter.
At SASH, brave little Misty Blue has astounded Dr. Steve Fernside and the team.
Tough little critter, aren't she, hey?
Against the odds, the tiny 5-week-old kitten has made it through life-saving surgery.
How'd it go?
Hey, Elise.
Oh,
Good. Here she is. Here she is. No, look, it all went really well. I mean, the hernia was the biggest part. The hernia was huge, the cat was small.
Oh.
It was not without its moments, but she's doing really well. I mean, she's so far, she's recovering well.
Breathing beautifully.
And she's breathing so much better, so that's a good start.
Good job.
Anyway, she's got a little way to go yet, but so far we're optimistic. It's good.
It's great. She's nowhere near out of danger, but the hardest part is done, and I've just got high hopes now that she's going to pull through this one.
Two very special visitors, Faith and Hugo, can't wait to see their precious little girl.
Oh, my baby girl. She's survived. Hi, baby.
You see how much better the breathing is?
Yeah.
When I said goodbye to her yesterday, I didn't think I was going to see her.
She's got a long way to go, but so far she's definitely taking steps in the right direction.
So she got through the hardest part.
The hardest part.
Oh, you precious little thing. Go, Misty! Misty power.
Okay, thank you.
Let's go.
In South Africa, a massive bull elephant is about to wake up after being given a contraceptive.
It's not going to muck around. Within seconds, his eyes are open. He's waking up quickly, but not quite as quickly as a rhino I treated on my last trip to Africa.
Okay. Watch out, watch out.
The rhino woke up far quicker than anticipated, and Chris had to make a run for it.
Yeah, I'd go.
Luckily, the rhino called off the chase.
Oh, got some oxygen.
It's going to get up, eh?
Here we go. Oh, good get, big boy. There we go. He doesn't muck around. There's something majestic and almost spiritual about watching a 4-ton elephant rise to his feet and really become the king of the African savannah once more. And then kind of changes the purity of the moment.
He's quite relaxing. So all's well that ends well, eh?
Yeah. It's just incredible. It's like nothing happened at all. He's back on his feet and ready to go. And all right, away he goes. Mate, thank you. That was very special, Johan. Thank you.
That was a pleasure. Thank you, eh?
Sure, he gave us a few heart palpitations, but to be this close to the biggest of the big five has been a real privilege. But also to be able to help out a species that has been under so much pressure is something I'll never forget.
Hey, gorgeous girl.
At SASH, brave little Misty Blue has amazed everyone.
Hey, you're playing like a normal kitten.
She's fully recovered from major surgery to repair her massive hernia, and it's a big day.
Misty, are you ready to go home? Are you showing me that you're ready to go home? Misty is doing so much better. She's bright, she's eating well, she's breathing normally, she's even putting on weight, and she's behaving like a normal kitten, which is what I was waiting for her to do. So I think she's ready to go home. Aren't you gorgeous girl? We're gonna miss you. Your mummy is gonna be very happy to have you back.
How exciting to get it back for your birthday. She can give you birthday snuggles.
Snuggle me.
Look who's here.
Hi there. Oh my God, she just looks cuter than ever. Oh, she's still got that little... Oh, she's got chubby. Hello, baby girl. Oh, she's purring already. Look who's here.
I Happy birthday, Hugo.
Yeah.
Well, this is sort of a birthday present.
It is, isn't it?
Best present ever.
Best present ever. Oh, she's hugging him.
Little kid.
Why don't you show Misty what you've got for her to take her home in?
Look, little snuggle.
Hugo's made you this beautiful bed to go home in.
We've all fallen in love with her. Hey, we're going to miss you, little Misty. The looks on Faith and Hugo's faces are absolutely priceless. They are grinning from ear to ear and they are showering her with cuddles. They just cannot believe that after all this time, after everything that Misty Blue has gone through, they are finally taking her home. Well, stay in touch. Good luck. You guys will be fine. She's very lucky to have you.
Thank you so much.
She's a lucky girl.
Okay then.
See you, Hugo. Bye.
Little bum. Misty. Bye-bye.
Hi, I'm Dr. Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.